Hi, this is Jonathan Jaroshow, publisher of the Diabetes Digest family of magazines and diabetesdigest.com. And I'm here with diabetes educator Joy Pape, and we're focusing on dental care today, and that's why we have some Colgate toothpaste in front of us, Colgate Total. Joy, recently you wrote an article on diabetes and dental care, and many people know about the link between good dental care and diabetes, in the sense that taking better care of your teeth and having good oral hygiene can help prevent diabetes complications. But maybe you can talk about the link between inflammation and gum disease and some of the things that are related to that.
Yeah, well, interesting you brought up the fact inflammation. We hear a lot about inflammation and we think inflammation is a terrible thing. Well, inflammation really is a protective device for any injury to our body, but only for a short term. But having inflammation for a long time wears on our body. So inflammation is related to diabetes, it's related to heart disease, it's related to arthritis, and it's related to dental problems. Okay, so where's the link here? We're not quite sure what comes first, the chicken or the egg, but we are seeing that people that have diabetes have a higher incidence of inflammatory or dental oral problems, and people that have a high incidence of these oral problems have a high incidence of diabetes. Now, what we do know, like you mentioned, a lot of people understand that if they've got diabetes, if they've got elevated blood sugars, that it can cause problems to their teeth. But what they didn't know is that by either taking care or not taking care of their teeth can affect their diabetes. So what happens is, and I think this is interesting because we always hear about brushing our teeth regularly, but why? We hear that we can get plaque. What plaque is, it's a bacterial film that we all get on our teeth, and the only way to keep that down is to brush our teeth regularly. And to keep it down, it needs to be twice a day and using floss or an interdental appliance. That's good, but if that's not done regularly, then what can happen is plaque can then turn into tartar. Tartar is what even hardens. It's from the word calculus, little stones. And that can get under our gums and cause problems, cause the gums to rise, cause infection in that. So it's important to keep our teeth brushed and keep that bacterial count down. And that's why I recommend the Colgate Total, is because within this toothpaste there is an ingredient. It's not just a fluoride toothpaste, but there's also an ingredient called triclosan, which is an antibacterial, which they've done the science. Emerging science shows this helps keep this bacterial film down, and also can help diabetes. So that's why I recommend Colgate Total. In fact, I was so excited. I was in Italy recently and saw it there, and I had to get this tube of it. Just, oh my gosh, even here in Italy. Well, really, all over the world. So that, and the other way of doing this is also seeing your dentist regularly. So you don't stop doing your teeth twice a day, but do that, use the right kind of toothpaste, and see your dentist twice a year. Or if you've got something called periodontal disease, you need to see your dentist 4 times a year for cleaning. So what happens is, if not taken care of, you can get something called gingivitis, and that's when you've got inflammation of your gums. That's when you hear about, you see commercials, you've read about a little pink in the sink. You've got swollen gums, they're red and they bleed. But if that's not taken care of, then it can get into something called periodontitis.
Right.
And so that's when it starts lifting and causes a problem.
Right. So the gingivitis, which again we've heard about, if it's not taken care of, it can lead to more serious complications to the periodontal disease, which is a full-fledged inflammation.
And then what can happen if that's going on, that can increase blood sugar, and so they can get into your diabetes care. So taking care of your teeth. Like the article I wrote, this particular woman, she was doing everything for her diabetes, but she couldn't manage her blood sugar. She didn't know why, until she went to the dentist and found out she had a problem. She got her teeth fixed, she got her teeth worked on, and her blood sugars came down.
Right, and I've heard, recently people are talking more about oral care as, the complication that people don't include as much. But I think more and more people are starting to recognize, and unfortunately, you have heart disease, you have kidney disease, you have the other. But oral care is something that people have to take seriously, more seriously, based on the studies that have come out. Like you said, there is science that connects the link both ways between taking good care of your diabetes so the high blood sugar doesn't affect your teeth, and the other way, making sure that you take care of your teeth so the inflammation doesn't lead to potentially heart problems and diabetes. So thank you so much for informing us on the subject. And everyone, get some toothpaste, some dental floss, and make sure to visit your dentist if you're someone with diabetes at least twice a year.
And tell your dentist that you have diabetes.
Okay. Thank you very much.